Our next speaker is Dr. Latha Devarajan. It is an honor to introduce Dr. Latha, a highly accomplished consulting physician, academic and research coordinator at MLD-MHI Bangalore and research fellow Ayush for MLD-MHI Bombay. With over 30 years of teaching experience and 26 years of clinical practice, Dr. Latha has been a guiding force in advancing homeopathy through her expertise and dedication. Pioneered in using standardized case records to manage both acute and chronic cases, specializing in tri-coordinate care, a holistic approach that focuses on the observer, patient and self. She has authored articles and case studies on a variety of topics including dysmenorrhea, dysthymia, PCOD, hypothyroidism and COVID management. She's co-authored a research paper titled Beneficial Impact of Homeopathy in Slow Learners, a pilot study published in the Asian Journal of Homeopathy in May 2016. Please join me in welcoming her.
A warm welcome and pranams to our sirs sitting in the front row, Ajit sir, Vahi sir, Bhaskar sir, Praveen sir and Asrani sir. And to all the wonderful audience, thank you for your time. And to my colleagues at NGH, warm memories of Vishpala ma'am and Sona ma'am for whom we are here today, Sarla Sonawala ma'am. I have been told to restrict to 15 slides, so let's just make it interactive. And the presentation is bronchiolitis. We'll just make it interactive. What do you know about bronchiolitis? Because the slide is not moving, so till then let's just make it interactive. What do you know about bronchiolitis? Age group? Yeah, very early, between 3 months to 3 years. Okay? And what are the key symptoms of bronchiolitis? What are the symptoms? Key symptoms? Key symptoms? Breathlessness, tachycardia, and it starts with a viral-like symptom, cold, cough, rapidly progressing to breathlessness and wheeze. Okay, is that clear? And what is important in homeopathic management is this a self-limiting illness? Is this self-limiting or is there a problem with this? Yes, quickly. Usually it's written in the textbook self-limiting, but it's also very distressing for the patients and for the caretakers because they have marked wheezing, tachypnea, breathlessness. They can also, we do not know after 3 days, are they going to recover or not recover. Objectives of my presentation are a series of cases that have different susceptibilities and how it's so individualistic are signs. So I would like to have your interactions on the patient. The first patient is, I'm just going to tell you the case briefly. The patient is coming with sudden onset of fever, cold, has been exposed to a large gathering, and then it comes down with these symptoms: restless, irritable, nausea, has loose motions, and after the 3 days, neither the wheeze is subsiding nor is the entire acute recovering. What remedies will you think of? Asa, because of restlessness.
Because of restlessness.
Yeah. Interesting. So let's again run through the case. The child comes with continuous fever. As is thirsty. This patient is thirstless, easily exhaustible, and the peculiar feature was she is being put into the play home last 2 months, which has made her exposed to these infections, irritable and cranky. And what will we keep note of in such cases is the quality of fever, the episode, how it has gone. Is this a rapid pace or a slow pace? The disease itself is rapid. What are the characteristics you can pick up in this child? the restlessness, the anger and irritability, the thirstlessness, and this kind of vomiting spell which is also coming along with the cough. So there's a GI sector and an RS sector. So can you all share some peculiarities of ipecac? Tongue is clean. Which family does it belong to? It belongs to the Rubiaceae family. And what is the characteristics of ipecac? Yeah, no. It's a remedy that overstimulates your mind and the nerves and the mucous membranes. So it is interesting to note, are these cases one-off cases for you? It is. It is a case of latent sora explosions, and these might be just one-off episodes. What is important is that this ipecac can also be a chronic remedy for this child. And you should keep in mind what is the ipecac mind while it evolves. The state of irritability, the suddenness, the spasm, and the activity of the mind, nerves and mucous membranes will indicate to you that this could also be a chronic remedy. Because if you have a remedy that is covering your LSMC so strongly, don't just jump to define the case and giving another remedy. Alright? Think of ipecac as a deeper acting, but this particular case is a one-off case. One-off explosion of the latent sora does not need follow-ups. Okay, we come to the next case. In the next case, a lot these remedies have already been shared with you. So let me just run through that. So the cases of a child which has cold, fever, breathlessness, which was mild. The patient was given Calpol and fever. The patient was bought because of the persistent dry cough, which is worse lying down. This is very clear to you, no? The acute face red with cough, Drosera, all of us will give. So what is the constitutional or a deeper feature of Drosera that will not allow you to move quickly from using Drosera as a medicine of acute? So that's what I want you to pick up. What will be the features of Drosera? Anybody knows the mind of Drosera? Persecuted. What else? Yeah, there's a lot of irritability and aggression in Drosera. It comes from the carnivorous plant that is actually growing on a nutrient for its on a nutrient poor soil. It needs proteins and hence it traps insects. The key feature is so much like a tubercular. Every time you think of a tuberculinum, you would like to follow this with a tuberculinum. Just remember that you're missing on Drosera because it's as hyperactive and aggressive like a tuberculinum. Then we come to the next case. You just let me come back. So in the next case, we have there's a child that has come. One second. It is not all cases will come to you with affections of respiratory mucous membranes. They can also have very characteristic mental generals. So this is a child who has come with 6 months baby. All that it is doing is crying and moaning in the clinic, and the mother has to cry and walk with it. Today is the 4th day of fever and the fever has subsided. Usually the first 2 days the parents just call us on the phone and we give them some acute. It's only when they don't recover and they come with this cough bout or this state of wheeze or some state residual symptoms which are not completely recovering. So this child also was brought with that kind of symptoms. So what do you think of a child which is constantly moaning and wanting to be cried and crying and wanting to be carried, but it has a very severe cough? Chamomilla. So why did you think of chamomilla? Yeah, you thought of chamomilla because it's being carried. But remember that chamomilla, when I was reading the presentation, I realized that chamomilla has a very distinct action on the nerves of the respiratory system. So even though the child you're prescribing on the mental generals, Remember, the oversensitivity of chamomilla also affects the mind, the nerves, again the mucous membranes. So each of these remedies have distinct action on all three levels, and do not change your prescription from chamomilla, because the chamomilla can be indicated even as a follow-up chronic remedy for the next episodes. So it may not come with a respiratory illness, because there's a distinct illness from exposure to a large crowd, which could probably be the reason for the virus. Either it could be respiratory syncytial virus, which is most common, or it could be the influenza virus. However, next time it comes, remember to keep this pathology and pace in mind. Overstimulation, mind, nerves with high sensitivity, it can affect any of the child's organs. Now let's go to another type. So just concluding this type of susceptibilities, they are morbid processes, sudden in onset, run its course, initiated by an abnormally deranged vital force, usually self-limiting, resulting in recovery or death. We give an acute remedy in the peak, but just remember, in this one-time episodes, it's also important to make a note of your entire totality of LSMC, location, sensation, modality, evolutions, ailments from, and concomitant with emphasis on the form, and also covering the mental children's. Interestingly, all these acute medicines itself have indications for a deep acting. Okay, so just keep that in mind. Now we move to another type of susceptibility. So this is a patient who has come after traveling just before the lockdown of COVID. She starts with a sneeze and progresses to respiratory distress with wheeze. With every cough, she's feeling the pain and crying deeply, holding the chest. She's breathless. She has high fever. On examination, this is an acute presentation. She has wheeze and rhonchi all over the quadrants. There's abdominal breathing, intercostal retractions, oxygen saturation was 93. The pediatrician who was monitoring her was asking for admissions. Out of fear, the patient comes to you because it doesn't want admission, and was having a respiratory rate of 35, sorry it's not 55, pulse is 90, and when in the clinic, all the child was telling us, when will I get well and go home? Bryonia, any other remedy? Arsenic is very restless and anxious, and this is a very alert child. Belladonna, and look at the pace of the illness. Quite fast, no? Quite rapid. Yes, keep these remedies in mind. Phosphorus, belladonna, any other remedies? Arsenic, aconite, any other remedies? Tuberculinum, yes, because this is the tubercular pace itself, the manner in which it is coming out. The earlier cases responded with few doses of 200. They are just explosions of the latent soda. This case, do you think will only settle with one dose? And do you think this is a little more deeper miasm we are dealing with? And there is not all patients will come with so much of clinical signs that we are able to examine, telling you the danger that we are going to face if we don't keep her on oxygen. Would you like to give her on oxygen support therapy? Would you like to keep her on support therapy? Sir, would you like to say something on that? On support therapy of oxygen when it's fallen to 90?
It can be given.
Yes, it can be given. And yes, sir?
Below 93, if the reading is correct, anytime what happens that in children, pulse oximeter does not hold properly. So, in children and small children, you have to put the pulse oximeter on great toe. Massage it. If it is truly below 93, yes, oxygen support can be given.
Yes. Thank you, sir. So this case was actually monitored by the pediatrician, and the pediatrician findings were written when she came to us, as well as the pediatrician had advised oxygen support, and I did not stop that support system. And I thought that it is important that we also keep note that Admission case is what we are managing at an OPD basis, which requires us to be extra careful. So I had to go a little bit into the depth of the case to be sure that what remedy I'm choosing and how am I. The most important are the follow-ups. What are the signs and symptoms you will keep in the follow-up to see that you're not messing up the case, and if needed, we need to send her back for the hospital admission. Is that clear? So the miasmatic understanding in this case as compared to the earlier cases is the pace, is the intensity of the weakness, is the rapid progressive of the illness, which indicates to us it's the tubercular miasm. So based on this, the remedy chosen was phosphorus. And the phosphorus was indicated because of the kind of pathology we are dealing with. This is a rapidly progressing illness where there's inflammation all over. We are treating an inflammatory condition. Just differentiate that. And the fever, which was high grade, is now low grade. And there are very characteristic symptoms. And the child is alert, active, in spite of the progress of the illness being so rapid. And when you go a little bit into the history of and ask the mother, she will say this child is always the playful, happy, talkative child. This is the first time she has come down with this episode because of this travel exposure. So you know that you're dealing with a remedy that is also covering her previous totality and her previous kind of a makeup and the present. And she's chilly, she likes cold things, lean and thin. Very, very close to tubercular as a remedy, but not as hyperactive as a tubercular. And neither is it as restless and anxious as an arsenic. It all that is asking for going hopeless is because she wants to get well soon. So that feeling of getting well soon and that child was not crying in spite of so much of distress allowed us to use phosphorus as a deeper remedy. Now what potency do you want to choose? Potency? Yeah? LM. LM is a good potency because of the low vitality that is progressing. I gave her 200 because of the characteristic mental generals that I saw. The only thing I want to make you note here is there are a lot of signs that you need to keep aware of. Only when they improve, you know the remedy is working. In this case, everything started getting better. The cough was taking time to subside. Hence, I had to introduce phosphorus 1 and single dose. So that's the only thing that I needed to focus on was the follow-up criteria. Now quickly, so these are the type of cases which have this kind of a pace. If the remedy itself is tubercular, you don't need to introduce any anti-miasmatic remedy. Now we go to the third type. This is the case of a child who's 1.5 years. The mother started working when the patient is 6 months, breastfed only for 4 months. It's also one of the reasons premature withdrawal of breastfeeding can also make the child prone to immune infections. The mother actually is a little bit of the type who doesn't bond as much as the father. I'm not saying right and wrong, role playing is changing these days. The father is more babysitting the child, working from home, very fond of it. So what caused the change in the susceptibility? Since the last few months, the father is training it for babysitting. And she's not used to this. What are the bells that ring to you? Why is the child suffering? Separation anxiety. And every attack is making her weak, lose weight, becoming cranky. What is the miasm we can think of? Losing weight with weakness is more tubercular, right? So what do we do with her? So the patient is reserved. We need to go deeper into her case because you will have to understand how you're going to put it chronic totality, acute and intercurrent. Reserved sensitive child, does not like scolding, and the mother was having to wean off. She constantly is crying for the father, and the father is helpless because now he is traveling out of station and he has to train her. So you can imagine what is the remedies. I think the chronic remedy is not a problem. Chronic remedy for this totality, quickly, not much time. Natrimure, yeah. So we started her on Natrimure. What is important here is there are two things. One is to take care of all her acute episodes. Second is how are we going to make the shift for this child from the father to the play home and reconnect with the mother. This is what we call as complete therapeutic planning and programming. So it requires us to counsel the setup, see that the environment, which we call the biological environment, the psychological environment and the social environment, that needs to be put in place for our planning and programming so that the child is also able to build the immunity while the environment plays its role. And our remedy also will make a difference. So the child was started with antimtat, same indications as what our sir indicated earlier. Extreme degree of coughing, rattling in the chest, acute was defined as antimtat, followed with Natrimure. But there's one thing that remained, there's a persistent rattling cough even after giving Natrimure. That's when I introduced Basilinum, because there was a history of eczema in the childhood, and no, just prior to this episodes of wheezing, she had an episode of skin. Therefore, I thought a Basilinum as an intercurrent will help her better than tuberculinum. And then we completed the case with understanding how to set up the environment. So while inquiring into chronic diseases, just ensure that you also take care of the maintaining factors. And what the case taught is how you're going to correlate all this clinical and pathological and biopsychosocial factors. And the physician will play an internal healer as well as an external healer to set right these type of susceptibilities that require understanding miasmatic blocks, precipitating blocks, socio-environmental blocks, and the need to use 3 type of forces to bring about recovery. Thank you.
Thank you, Dr. Latha Devarajan, for very good, interesting cases and learning cases.